For the first time, I've come before you, surely unprepared. I've had my script written several times. I've had about 3 of them, and I was just confused. I've had people, colleagues here, very gracious and asking me, please, just submit. But I've failed, and Olivia has also been kind, reaching out and saying, please, are you sure? And I've told her, well, let me see what I can do. So I've come before you really unprepared. 2 important years in my life, 1994 and 2018. They are important. Why? Because I lost my mother in 1994, and I lost my dad in 2018. And in 1987, my country was moving away from, some kind of economy where the state is in charge. And why this is important, it's because the World Bank, together with the IMF, were very supportive in terms of trying to advise the government on how to, make economic reforms. But those economic reforms had a big impact, if you like, a negative impact on our people. And that is how my mother was affected, because there was a shift from the state owning its enterprises and, leaving it up to the market forces. That meant that the government had to now free up the economy and allow private individuals to control important sectors, for example, education and health. So in 1987, that is when there was a shift. The state actually opened it up, and we had to embrace the private sector in terms of controlling some of these public goods, such as health. And that is why 1994 is important, because that is when I lost my mom. I remember one morning when she was preparing and going to the hospital. She was heavy and she was due. And I was only 9 years at the time. And she told me that, don't worry, Anthony, I'm coming back home with visitors. And I was quite very naive at the time. I didn't know what she was talking about, but you could see she was heavy, and my uncle was besides her. My paternal uncle was besides her. So there was no ambulance, but they improvised. There was a private car that came and picked her up. And young me, I was super excited, very curious, saying, oh, I'm going to meet some visitors just in an hour's time. But shock on me, just a few hours after, I saw my uncle coming back home, crying and weeping, and I sensed that there was something wrong. He couldn't tell us. He just kept on crying and weeping, and I was quite disturbed and looked on. Gladly enough, our neighbor came, and he broke the news while crying that Jacqueline has passed on. And it dawned on me that I had lost my dear mother. When I discovered later, I found out that my mother was taken to a private facility, and we did not have enough resources to rescue her life, because I think she needed blood at the time, because I'm told she was losing a lot of blood because of the obstructed, labor. Unfortunately, my dad did not have the money, and my uncle too. So that was 1994. The effect of, taking on policies that are not, informed by, people who are actually affected by these policies. Fast forward, 2018, same situation. This time around it was different. We couldn't afford going to a private health facility. My dad was terminally ill. He was badly off. And he was HIV positive at the time, and quite in a bad state. And at the time I was doing my bar course, and I received a call that I should go and look after him. The bar course is really a different experience. It's hard for those ones who do law. It's quite complicated, and if you're having personal issues, if you're going through personal issues and you're doing the bar course, you're bound to fail. Gladly enough, I got the courage after exams, and I joined him at the hospital. This time around, it was a government hospital. The motivation of us going to a government hospital was we couldn't afford, again, going to a private hospital because it's quite pricey and expensive. So during my stay at the hospital with him, it was quite interesting because I was the only child, because I come from a large family with so many. My dad had over 20 children, but I was the only one at his sick bed. And so we had fun, but I didn't know that he was saying bye to me. And so just a few minutes when he was fighting for his life, he needed oxygen, but the cylinders were not enough in the hospital. So I kept running around, looking for a cylinder for him to actually get, some oxygen. And I succeeded. And when I got one, literally I got one from another patient, and I literally pleaded. I said, okay, just give me 2 hours. Let me carry this cylinder, take it to my dad. And then once he's stabilized, I'll bring it back. So we negotiated, and I got that cylinder, took it. And of course he regained, and he was full of life again. But it was short-lived, because when I was trying to feed him, that is when I lost him. That's how I lost my dad. And so it hit me hard, because my dad believed in me, and he wanted me to shine as a lawyer. Even before his death, we had, neighbors around us, and he kept telling them that in case you have any legal issue, here's my son. But unfortunately, he passed on. And so enter COVID. And there was same story. Patients were badly off, and they couldn't afford the medical bills at the time. And so they had to go to, private health facilities to get some support. And you'll ask me why? Why would they dash to the private health facilities? It was because we still have a struggling public health infrastructure. Our hospitals are not in good shape. We do not have doctors. Many doctors, they are not paid well, and so they prefer working in private health facilities. There are drug stockouts, so even if you wanted to really go and be attended to, you'll not even get the drugs. Okay, if the workforce is there, but you'll not get the drugs. So the only option for you is to actually go to the private health facility. Now, there was a challenge at the time in these private health facilities, the owners were making a kill. People were vulnerable. But instead of supporting them, they looked at it as an opportunity because of the structure setup that we have in my country. And I felt bad about this because there were many stories coming out of patients being detained. And it was really disturbing, and it reminded me of my personal experiences. And I felt that, you know what, I need to do something using my skills. I'm not going to look on. Something has to be done. Because the state had actually taken a back seat and had left everything to the forces of, to the market forces, and that was problematic. So together with my colleagues, we felt that we needed to do something about this. One, the medical prices were astronomically high, and not many Ugandans can afford that. We have a population of about 49 million people, and about 73 of that population lives in the rural areas. And about 35 or 40% of that population cannot even, survive on a meal, a day, We have people who cannot even, pay for their own medical bills because of the unemployment issues that we have in our country. The people who can actually survive on a dollar are just very few. Most of our people actually survive below $1. And so I felt that something has to be done. We need to call up the state to do something about this. You cannot leave, this important good to the market forces. And that's how we ended up in the courts of law. And we were asking just something simple, that, you know what, the government should actually take its position to regulate private health providers. That was our simple ask. And we made it even very simple. We said, they need to consult, they need to check with the stakeholders and at least come up with fair medical rates so that, people can afford these medical services. And we also felt that the idea of detaining patients must stop. So those were our prayers. And luckily enough, in January, we got a very important decision. Court agreed with us and asked government to be in charge to regulate private health providers. So we get this decision while I'm in DC. And when I received the good news, many of you were really happy with me, especially with that achievement. And I felt that that wasn't the end, because a few days after the celebration, the Attorney General appealed, and I said, okay, something has to be done. And I was still figuring out what project should I take on. And I remember sitting with Sammy, and Sammy telling me that, you know what, Odur, something has to be done. Don't give up on this cause. If they have appealed, then you need to do something. Please, can you turn this into your project? And that's how I got this as my project. So during the fellowship, I was able to learn many things. I didn't know much about stakeholder mapping and how to engage. As lawyers, we want to fight all the time. But the fellowship taught me one thing, that no, it's not about fighting all the time. You need to actually identify those stakeholders that can help you in your cause. You don't have to, be forceful. You just need to be, you need to tell your story well, persuade them, and see what can be done. And that is something that I learned, through the fellowship, how to do the stakeholder mapping and how to communicate. And that, I must say, has been helpful, because back at home, we've been able to engage the stakeholders in a more constructive manner, in as much as the appeal is there. And some of the stakeholders are getting to appreciate our dilemma, because some of them are going through the same challenge. They're going through the same experiences. And for me, it has also helped me now to collaborate with the experts in the sector. I'm not a doctor, but during the fellowship, I was able to hear different voices, I was able to have, sharings with Jen, sharings with Wilfred and Jose. And Jose would, spark, there's a way he would trigger my mind, He has this sense of, provoking you. And in a way, it would make me, start thinking of how I should actually make a case. And for some reason, I've also applied, the ideas of Nyabon, of how to now reach out, go to the community and speak to the people, especially the victims, the ones who are feeling the heat. And I must say that we've gotten good feedback that has actually informed our submissions, our skeleton submissions that we are yet to file at the Court of Appeal. The fellowship has helped me to understand that, it is not even about numbers. I think it's important to give it a human face. And, just the storytelling when I'm engaging the stakeholders and telling them that, look, there is this mother who was detained just because she was unable to pay the medical bills. And when you bring the mother in the house, the stakeholders actually appreciate and say, oh, something has to be done. It has helped us now to trigger the conversation about the health insurance bill that has been gathering dust. And at least the stakeholders are saying, no, something has to be done here. We cannot allow this. We need to do something about this. We cannot allow people to, be dehumanized and to be treated as less human. And the journey that we had in Rwanda has been helpful, because I've used that as an example and telling that, look, next door, these people are doing this. I mean, we can do it. It's possible. And I'm glad that there is progress. And I believe that we are going to succeed on this, because health is a public good. The right to health has also been recognized by the Supreme Court of Uganda. And I believe that in the Court of Appeal, we are going to make a strong case that we are having many of our people struggling, unable to actually afford paying some of these private health providers, and yet they need assistance. We've also engaged some of the private sector members, and we are saying, yeah, we hear you. You're talking about utilities. You're talking about issues to do with taxation, importation of your medical equipment. Something has to be done. The state has to subsidize some of these. Give you a waiver when it comes to taxes, and that is also bearing fruit. And this has all happened because of the fellowship. Hearing from my colleagues, their ideas. Of course, on the sides, I would listen to AFHE, the ideas, especially from the NHS. And I'm saying, oh, we can borrow something from although it's a developed country, we can borrow something. So as I move out of this place, I believe that there is hope. There is hope. Why? Because I have friends at a global level coming from different countries. And if we want to do advocacy, especially for my country, I'll not have to struggle. I'll have to reach out to Mario, who's strategically located in Geneva to pull some strings here to support to support my community. I'll reach out to people like Sami to see how we can also incorporate, ideas, technologies, into supporting our people in Uganda. Thank you.